a common concern. This week's podcast episode goes in depth into the types of acne, how exactly acne scars form, as well as the different types of scars that can develop. We will also discuss how best to prevent and treat acne scars. First of all, acne scar treatment starts with understanding acne itself. There are a few broad categories of acne. First, physiologic acne, also known as teenager acne, is the commonest type of acne. Second, adult acne or hormonal acne. Hormonal acne usually affects women and tends to coincide with certain times in their menstrual cycle. Another category of acne is known as steroid-induced acne. These are acne bumps caused by the use of medications, such as oral or topically applied steroids. Maskne is a form of acne mechanica, a type of acne caused by occlusion. This means that acne forms over areas where the skin is occluded, either by comedogenic creams or physically by materials, for example, face masks or sports helmets. Acne scarring is one of the main reasons why dermatologists advocate early treatment of acne. The key here is that a correct diagnosis of acne is equally important. Many conditions such as rosacea, eczema, and fungal folliculitis, which is inflammation of the hair follicles, can lead to redness, bumps, and scars on the face as well. However, they are different from acne and must be treated with certain prescription medications. Once your dermatologist diagnoses you with acne, you may be offered prescription medications for moderate to severe acne cases. The focus of today's podcast episode is on over-the-counter skincare options that can be an effective complement to your acne skincare regimen. Specifically, skincare that can treat and prevent acne scars. Early diagnosis, prevention, and treatment is the best way to prevent acne marks. The reason is because the longer acne goes on, the more severe it gets. The acne scarring that occurs also gets worse if acne is left to flare. Acne and acne scars can severely affect the quality of life of individuals who suffer from pimples. It is a misconception that one can just grow out of acne. This is the reason why the American Academy of Dermatology always recommends for parents to bring their child to a dermatologist for acne treatment rather than waiting for their child to quote-unquote grow out of it. A dermatologist's viewpoint is that growing out of acne does not always happen and is in fact a bad choice. At its roots, acne is considered a genetic condition. These genetics drive inflammation, which together with a surge of hormones during puberty leads to oil production, resulting in acne. While it is true that physiologic or teenage acne generally settles after puberty, the resulting scars may stay for life. Advanced acne scar treatments, such as lasers by dermatologists, may not guarantee clearance of acne scars. Sealed laser resurfacing may help to even out textured acne scars, but will not restore skin to 100%. This is why we must prevent mild acne from getting worse. Acne marks in their early stages can also be treated effectively with skincare. Also, many adult patients continue to have acne past their teenage years. Now, you may be wondering, how do I know if I am at risk of developing acne and acne marks? The risk factors of developing acne include a family history of acne, especially when oral medications were required for treatment. This means that moderate to severe acne was present. In addition, women who have irregular menstrual cycles need to be screened for polycystic ovarian syndrome. As there are some cases of adult hormonal acne that are due to PCOS, these cases should be managed together with a gynecologist. Acne marks and scars are actually caused by inflammation of skin tissues. Acne itself is linked to the process of inflammation. Genetics drive inflammation, resulting in blackhead and whitehead formation. This process is known as comedogenesis. If you've heard of blind pimples, these are essentially whiteheads or closed comedones. Whiteheads, blackheads, inflamed acne bumps, and cysts are actually all different manifestations of acne, but they are treated similarly. Next, we want to understand how bacteria causes and worsens acne flare-ups. An important aspect of acne is actually bacterial infection. If you notice pus coming out of your acne bumps, this is because of a secondary bacterial infection known as gram-negative folliculitis. Acne itself is directly affected by a bacteria known as Cutibacterium acnes. Individuals with acne have a high proportion of this bacteria on their skin, which is directly linked to acne outbreaks. Next, the influence of oil on acne must be understood. Oil or sebum production is an important aspect of acne formation. Oil directly stimulates inflammation and is a risk factor for acne formation. Sebum production is affected by the hormonal fluctuations during puberty. In adult women, hormonal fluctuations during the menstrual cycle account for hormonal acne. At certain points in the menstrual cycle, there is a surge in the male hormone testosterone, which causes skin to be oily. This then leads to acne in acne-prone individuals. How do we identify different types of acne scars and marks? Well, there are two main types of acne scars. There are scars which are due to post-inflammatory hyperpigmentation, or PIH for short, and also deeper acne scars known as ice pick or boxcar type of scars. PIH is a form of pigmented acne marks that occurs shortly after the acne bump has resolved. Now, what are the stages of acne scar development? Post-inflammatory erythema or redness is usually what is seen in the early stages after a pimple resolves. Quickly after that, the redness then develops into pigmentation. What's worthwhile to note is that acne scars and marks are more obvious in skin of color. acne scars are more prominent in skin of color because of the higher amount of melanin present in skin. For example, Asians in Singapore naturally have more pigment in their skin. Pigment is measured by phototypes in dermatology. For example, Singapore's ethnic populations are of phototype 3, 4, and 5. Skin of color has more severe post-inflammatory hyperpigmentation compared to their Western Caucasian counterparts. Another type of acne scarring is deeper and may not be reversible once formed. Ice pick and box cut type of scars are a form of dermal scarring. PIH occurs at the topmost layer of skin, the epidermis where melanin is deposited, as a reaction to inflammation. For dermal scarring, the ice pick and box cut type of scars mean that inflammation has gone deeper. This is at the level of the dermis. Usually, if you have an acne cyst or a very angry-looking acne bump, it has the potential to develop into an ice pick or a box cut type of scar. How do I know if I will develop deep indented acne scars? If you have family members who have severe acne scarring, you should take good care of your acne marks because there is often a genetic tendency for poorer outcomes of acne scars. This brings me to the most important aspect of this podcast, how we treat and prevent acne scars. The critical aspect I want to highlight for the treatment of acne marks and scars is this. Prevention is key. Certain skincare ingredients are readily accessible and effective for prevention and treatment of acne marks. Once you have a pimple that has developed, an anti-inflammatory acne serum or acne cream helps to quickly quell the inflammation. The Eucerin Pro Acne Solution Triple Effect Serum contains thiamidol, a patented ingredient that has been proven to improve acne marks and to prevent its reappearance. Thiamidol is a gentle ingredient that works well for PIH caused by acne marks. Specifically, thiamidol is effective in the treatment of post-inflammatory hyperpigmentation caused by acne scars. The triple effect serum also contains lycocalcone A, derived from the roots of the Chinese licorice plant. Lycocalcone A is a powerful antioxidant with anti-inflammatory and skin-soothing properties. Sun exposure causes darkening of acne marks. Here is how the triple effect serum helps to build resilient skin. An important aspect of this ingredient is its ability to promote skin resilience. This means that it can strengthen skin so that it is less susceptible to changes in the environment. For example, lycocalcone A can protect cells from excessive UVB and UVA rays. This helps to reduce pigmentation in acne marks. Specifically, it is incorporated into the triple effect serum as a way to protect the deeper epidermal skin cells from UV-related hyperpigmentation. There are also additional mattifying and oil control properties of the triple effect serum. On top of that, mattifying pigments in the triple effect serum help to deliver a cosmetically appealing effect on skin. This is important in those who suffer from oily skin in a humid country like Singapore. Oily skin can be very uncomfortable and even socially embarrassing. The anti-shine sebum regulating technology in the triple effect serum helps to give a long-lasting dry and matte finish. Now, going to the science of the triple effect serum, let's have a look at the studies conducted by Eucerin. In a clinical study involving 40 individuals, there was up to 80% improvement in the appearance of acne marks in just 2 weeks of use. Results were promising as users consistently demonstrated improvement in up to 3 months of regular use. In particular, these studies paired the triple effect serum with the Day Bright Mattifying SPF 30 for optimal results. This brings us to the next important aspect of acne mark treatment and formation: sun protection. I want to zoom in on the importance of effective sun protection when you're trying to prevent acne marks and scars. Once the acne bump has formed, the key here is to minimize the chance of it becoming a bad scar. Sunscreen is a fundamentally important aspect of any good skincare routine. Moreover, an excellent sunscreen can actually protect your skin from developing worse acne marks due to sun-induced skin damage. The active ingredient in the Day Bright Mattifying SPF 30 includes decanoidole, which is a moisturizing ingredient with additional antibacterial properties. It is known to fight bacteria such as Cutibacterium acnes, which is involved in the development of acne, and also bad bacteria that colonizes the skin of individuals who have eczema, such as Staphylococcus aureus. This is how the Day Bright Mattifying SPF 30 works. Firstly, it targets the acne marks and scars. The SPF 30 UVA and UVB filters protect from sun-induced darkening of post-inflammatory acne marks, and this also prevents their reappearance. It also has antibacterial decanoidole, which helps to prevent pimples from worsening and also prevents secondary bacterial infections. Lycocalcone A present is also an additional effective anti-inflammatory agent that helps to calm skin. This plant root extract can also block the production of Cutibacterium acnes. Finally, both of these products by Eucerin incorporate mattifying pigments. This helps to reduce excessive oil production and has an appealing anti-shine effect. It is an ideal addition to your skincare regimen to treat acne marks and scars. Overall, these two star products of Eucerin's Pro Acne range are considered synergistic in the management of acne marks and scars. In particular, thiamidol is well researched by Eucerin to be highly tolerable in terms of its ability to treat acne pigmentation, even in very sensitive skin types. This is coupled with the development of a sunscreen that can optimize both the user experience and also deliver scientific benefits such as oil control, antibacterial properties, as well as treating acne marks itself. Well, we've reached the end of today's masterclass on acne marks and scars. Be sure to check out the podcast website at www.scienceofbeauty.net and also stay tuned for more podcasts on skincare hair care, and all things related to beauty.